Hi guys, welcome to my channel. Today we're doing an episode of
Mukbang!
My name is Chena and I am a registered dental hygienist.
My name is Dr. Deleon. I'm a dentist.
My name is ZJ and I'm just a regular human being.
He's our guest today though. Yay! Alright, well we have a ton of food ahead of us. We have Peking duck, we have lobster noodles, a bunch of dim sum that we're all going to dig into today. But let's change it to something more comfortable though. Let's get started. Alright, what should we start with, guys? We have a lot of selection.
Maybe the Peking duck while it's crispy.
Yeah, let's do that. It's been a while since we gathered since COVID.
Yeah.
It's been
when
so
was that
long.
last time?
Last time, our last mukbang.
Yeah, 1 year ago. No, more than that.
More than a year ago.
Yeah, more than a year ago. We did a Jollibee challenge. Go to Iggy's channel to check it out.
That you won.
Yeah,
That you beat me.
Wow, you still remember?
Yeah. I'll drink the gravy.
Oh yeah, the punishment. Ooh.
Yeah.
All right, cheers, guys.
Cheers. What's this place called?
Champagne seafood in San Mateo.
Not sponsored.
You should though. You should. Yeah, today we're gonna go over, debunking some dental myths for you guys.
Question number 1. Water picks versus actually flossing.
Sure, I would say, first of all, use the one that you would actually use.
I totally agree. The main point is a lot of patients are lazy to do it or they don't want to do it is because it's something they don't enjoy doing. So what we usually tell you is we'd rather you floss with whatever you like, as opposed to okay, we recommend you water floss, but you don't like using it, so you're not going to use it and it's just going to collect dust, right? So it's whichever one. But if I had to choose, I actually really like manual flossing more. I feel like you can get all the way in there a little bit better and it's more effective to me. But for patients who absolutely refuse to floss, then I would say, hey, water pick. That's really easy. You just kind of point it in there and does the job for you instead of putting your whole hand in your mouth kind of thing. So depends.
Yeah. There's also water picks that you can install in the shower. So if you're really lazy and trying to do everything in the shower, that's a good way. I would say if you have braces or maybe bridges where you have a missing tooth, you can't floss between it, use a water pick then. But I still prefer manual.
Same. I also prefer manual.
What makes you say you prefer manual?
I would show you, but my hands are a little bit dirty. But you can actually get all the way in between, underneath the gum lines where a lot of things get trapped. And the water pick is good too, but it's always the manual removal. It's always really nice because you're rubbing against the tooth and you're kind of cleaning that surface. And then I think it does a better job.
Basically, brushing gets the outside of the teeth, but the flossing gets where the brush can't get in between mechanically.
Right.
Do you have a favorite floss?
I used to really like Johnson & Johnson, the yarn one, but they discontinued that. So I've been using Reach, the thicker ones, because I feel like Glide. It's really thin, and it just kind of slides through, but doesn't pick anything up. So
Literally glides through.
Glides through, yeah.
I feel like it doesn't really work as well because it just glides over it.
Yeah.
High alcohol content of mouthwash. What is bad and what is good?
I usually recommend mouthwashes that don't have alcohol content at all, because what happens is when you use ones that are high in alcohol content, it dries out your mouth. So for people who are very prone to cavities, what happens is that if your mouth is too dry, it causes this environment that the bacteria likes. They like lower pH levels. So you want to keep your mouth neutral, so it's something that they can't really thrive in. So that's why I usually recommend ACT, ACT, or
Listerine Zero.
Yeah, just anything without alcohol. I definitely recommend that.
I totally agree. I always tell patients, if they are going to use alcohol mouthwash, don't use it at nighttime because your saliva already decreases when you're sleeping. So the saliva throughout the day washes things off your teeth, so the bacteria can't accumulate on your teeth. But if it's dry from the mouthwash, then that's really bad at nighttime.
Is flossing really necessary?
The saying in dental school is you floss the teeth you want to keep, right? Because you're brushing the top half of your teeth most of the time when you're brushing, but how about underneath the gum, So basically that's what the floss is doing. It's getting all the way down there and getting all that junk out. Because if you don't, sometimes you feel it like swell up a little bit. You know, it can be from inflammation.
Yeah. So basically, plaque builds up like in between your teeth or like around it, and then near the bottom of your tongue is salivary gland, and it's, you know, that's where your saliva comes out of, and it has calcium in it, so it solidifies the plaque that's on your teeth, and then becomes calculus, right? So if you don't clean off the plaque with the floss, it hardens up, more bacteria pile up on it, and that bacteria is producing acid that, you know, irritates your gum and your bone. So if you let that keep going, then you're gonna lose your teeth because there's no more supporting structure. So you either lose your teeth because of a cavity, or, you know, gum disease and bone disease. So yeah, it's important to floss to make sure that doesn't build up. Also, a lot of people think that they can floss the morning of going to their dental cleaning.
Doesn't make a difference.
We can tell.
Things built up over those like times.
I've definitely done that. Like floss the day of.
Bleeding gums is not normal.
Yeah.
It's not. Yeah.
It's not.
I have bleeding gums.
Yeah.
So at first, if you get in the habit of flossing, it's gonna bleed at first because the gums are inflamed.
Right.
But over time, your gums will be healthier, and then it won't bleed anymore. Less pain when you get a cleaning too.
Totally agree.
We're not trying to hurt you. Let's try this.
A bun?
The bun.
I guess you can do that. Yeah.
Hey.
Focus.
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 Do the beauty guru thing. You gotta do the beauty guru.
Try, but keep saying that's beauty.
That's beauty.
Can I just leave my wisdom teeth in there?
If you can clean it, if you have room in your mouth for your wisdom teeth, and you can clean it well, then you can leave it alone. But most of the time, there's no room for it, so they grow in sideways, or they're like stuck underneath the gums. It's called an impacted wisdom tooth, and that's when you want to take it out, because if you leave it in there, it can affect the root of the tooth in front of it. That would be bad. Or sometimes it's partially coming out of the gums, and food and things get stuck there. And then you keep biting on that area, and then it just swells up, like you get a bad infection.
Yeah. For me personally, I left it in for the longest time, and it kind of pushed, so it started crowding my lower. So that's also another thing too. I feel like it can cause misalignment.
That's what my dentist told me. I had all 4 taken out all at once, because he said that it would. I got braces, and then all of that would be waste if I let the wisdom teeth grow.
Ooh, good call.
Yeah.
Get it out ASAP.
ASAP.
The younger you are, the faster you heal.
Yes.
I got mine out third year of dental school, so that was like, what, 2 years ago? I got dry socket, which is basically when the extraction site gets infected. The blood clot comes out. Wow. And it kept me up for a couple of nights. It was probably the worst pain I've ever had. So follow the directions that they tell you after the extraction, or else you'll be in pain.
So I've started to use. I whiten my teeth maybe like once a year. I don't know if that's bad or good. So I wanted to ask Crest White Strips your opinion on it, and if I should do it every year, every other year.
Whitening, I would say, if you have sensitive teeth, try not to use it so often. But usually for people who want their teeth whitened, I would say start off with the Crest White Strips. Do it for like 2 weeks. See how it is, if you can handle it with the sensitivity. If you want more, you can come into a dental office where we give you a custom fit whitening tray, and then we use
gels, whitening gels.
Whitening gels. Alright, yeah, this is called opalescence. It's 10% carbamide peroxide, which is basically hydrogen peroxide, and it whitens it. It's stronger.
And it's monitored by a DDS who can tell you, okay, maybe we should hold back on it. I also wouldn't recommend if you have thin enamels too, because what it's basically doing is it's removing the outermost layer of your enamel, right? So that's what the whitening toothpaste, whitening strips, or any of that is doing. It's either chemically or mechanically removing it. They have a coarser toothpaste for whitening. That's how they whiten your teeth. They're removing the outermost layer of it, basically.
Is that bad?
If you do too much,
If you do too much, but the outer layer of the tooth is mostly minerals, right?
Right.
It remineralizes, so you get that back. Mm-hmm. So when you go for a cleaning, they put on the fluoride after to help rebuild the bonds on the outside.
Right. So the thing is that you just don't want to keep doing it too often for whitening if you have really thin enamel or sensitive teeth.
Mm-hmm. Yeah, that would take 2 weeks, right?
Yeah.
And then just maybe once a year.
Mm-hmm.
Okay,
yeah.
Cool. That's how often I do it. It's like once a year. Mm-hmm. Sometimes not even 2 weeks. I'll do it for like a week or less, depending on how white I want them.
Right, exactly.
A follow-up question to that is toothpaste. Which one would you recommend?
They actually have a chart online that tells you the most abrasive to least abrasive. I can probably link that in the description box, but you want something that's not super abrasive. I personally like Sensodyne. The Pronamel, not the whitening one as much, just because that's a little more coarse. But I would definitely recommend Sensodyne. That's one. And then I know a lot of people like Tom's.
I use Sensodyne too, just because I have sensitive teeth. If you brushed hard for a long time, your gums recede. And that lower part of the tooth is more sensitive to cold, because there's little holes there. So the Sensodyne, the way it works is, there's
potassium nitrate that kind of covers up the tubules. Is what they call it, tubules. Like your teeth have pores, kind of like your nose, you know. But yeah,
really,
yeah. So your teeth has pores on its own. So once that's exposed, you know, that's why it's sensitive. And Sensodyne has that ingredient that helps to cover up those tubules, so it's not as sensitive.
Are braces more effective than Invisalign?
It depends. With Invisalign, the patient has to be really compliant, right? Because you have the option of taking it out whenever. You're supposed to be wearing it 20 to 22 hours a day. So basically, you're just taking it out when you're eating. But if you forget a lot, you're going to be stuck in the same tray like forever. you get assigned like maybe like 40-ish trays to gradually get you to where you want to be. But yeah, compliance is huge. Even though the Invisalign technology has gotten really good, there's still some things that it's better to go traditional braces.
Probably with like younger kids too, who probably wouldn't take care of
who aren't also compliant either.
Yeah.
So it depends as well. But also hygiene wise, it's
hard
harder. If you're usually not good at it, you have to be extra good at it because you have more stuff in the way. So if you don't take good care of it, you might come out with more cavities. You just don't want that as well. So if you are considering either or, just definitely like up your hygiene game.
Yeah, I would say even before getting braces, the provider should be making sure that the hygiene's good and that they don't have cavities already. Like Chena was saying, if you let the things build up around the brackets, when you take off the brackets, there's going to be white spots around those areas. So the start of a cavity, usually we call it like white spot lesions, where the bacteria is starting to penetrate through the enamel. And then it's like chalky white.
Yeah.
So you get a bunch of that and your teeth are just messed up after.
Yeah.
Tongue health. What is the best way to take care of your tongue? Is that even in the realm of a dentist?
I use a tongue scraper.
I also use a tongue scraper every morning.
Miss your tongue or something like that? I don't know.
There's a lot. There's different ones. Yeah. Definitely does affect, your breath as well because that's bacteria growing on your tongue. So I would definitely recommend also brushing that as well or scraping.
Yeah. So there's like plastic ones or metal tongue scrapers. I use a metal one just because I feel like it's easier to clean, like more hygienic.
Same. Yeah. I also use a metal one as well.
I feel like a lot of people don't brush their tongue, and that's also a place where bacteria really grows.
Yeah.
And people who like brush their teeth every day can still have bad breath because they don't brush their tongue.
Yeah,
exactly.
It's like all white.
Ooh.
Yeah. Or black.
Oh yeah, hairy black tongue.
Hairy black tongue.
But those are usually because they're smokers, right? Or is it just like hairy?
Not all the time. I think, yes, you see it in smokers, but sometimes isn't it genetics as well?
Genetics, like the anatomy of their tongue.
Yeah. It's harder to clean because they have a lot of grooves. So more bacteria gets in there and it's harder for them to clean, so it doesn't get cleaned.
Are implants similar to veneers? Or are veneers a type of implant?
So veneers are basically like...
fake nails.
Oh.
You just,
draw some in the tooth and put it on.
yeah, you just like paste it on basically. So that's what you're doing with your tooth.
And an implant is actually like a whole tooth, like.
Yeah, like a whole screw in there, and then with the whole crown too.
It's replacing a missing tooth.
Yeah, so the tooth is missing, but veneer, your tooth is still there, but maybe, you know, something happened on the top part, you know, or it's missing tooth structure.
Almost cosmetic.
Cosmetic, yeah.
Like when you see those people like online or on TV with a really white,
White
perfect teeth, those are probably veneers.
Yeah.
Yeah. And as we're eating this food, how does food and diet affect your teeth?
I always recommend don't brush your teeth like I'd say an hour, maybe 30 minutes.
Oh yeah, I say 30 minutes.
Don't brush right after.
Yeah.
Because the outer layer of your tooth is weaker during that time because of the food has acid sometimes.
Yeah.
So if you're brushing, especially if you brush hard, it's weaker, so you're brushing away more of the minerals.
Yeah, you're just weakening the enamel, so you just want to give it time to replenish, you know, with your saliva kind of neutralizing it, or by drinking water too. Usually when I eat any dessert or anything like that, I swish my mouth with some water just to help out too. But definitely 30 minutes to an hour.
Yeah, but if you're drinking or eating something really acidic, wait like 2 to 3 hours.
Yeah.
Like soda. Like if you drink soda,
anything lemon,
orange juice.
Yeah.
Because I've seen some like really messed up teeth from like acid erosion.
Like coffee. Coffee's also acidic, right? Or no?
Some of it.
Yeah.
But more so like
lemon.
Lemon.
Okay, got it.
I had a patient who ate like a whole bag of lemons every day.
Ooh.
Wait, ate a bag of lemons?
I can only imagine how
eroded
it looks.
Paper thin teeth.
And it's like yellow because you can see the inside, the dentin.
Wow.
Yeah, the inner layer of the tooth is yellow.
Yeah.
So they basically wore off
the enamel.
That's why, like with older people too, you'll see like their teeth are more yellow because they've worn away the outer layer.
Okay. How did you, I guess, consult the patient about?
They needed crowns.
Really? It was that bad?
Yeah.
All around crowns?
All around.
Dang.
Because it's brittle at that point. Because you have to imagine it's like a lot of the tooth structure is missing. So if they, I don't know, bite on something super hard.
Oh, it's gonna break. Yeah.
Yeah, it can just break the tooth.
Mm.
I really like watching extractions. I don't know why. It's really weird. Like, I love seeing the blood gushing out. I'm so sorry.
Yeah. That's my favorite thing to do.
Yeah.
I love extractions.
Me too. Yeah. Yeah.
Is it just like super satisfying to watch, or?
I think it is.
I had to take it out.
Yeah, he gets to take it out. I just watch.
If you want to save your teeth. But,
yes.
You know, sometimes you just can't. It's just fun.
Like popping, fun. You know how some people like
a popping pimple. Yeah.
Pimples,
same thing.
Popping zits.
Yeah. One crazy one I had in hygiene school was when I was doing anesthesia. So it's the nasopalatal injection. So it's right here, like right above there. And I told him, all right, we're going to begin now. And then I stuck the needle in. Out of nowhere, he sneezes and my whole needle goes. And I was like, oh my God.
Wait, goes where?
It goes up. But, you know, he wasn't hurt or anything. But, you know, the needle definitely went up.
He didn't feel anything?
I think he was sneezing, so he didn't feel anything. But the needle is thin, so, you know, I don't...
You probably use an extra short gauge, right?
Yeah, it was a short, yeah. So he didn't feel anything, but I was freaking out on the inside. I was just like...
He didn't, like, do a... before the sneeze, you know?
No, he just went... Achoo! And I was just like, oh my God, wait. I need some warning.
Warning, hello.
Yeah.
I did do a root canal once. So this guy's tooth was infected, and, you know... You drill off the top of like a hole in the top of the tooth, and just gushed out green.
What?
What?
Oh my God!
That's like all the infection was like building up in there and just like burst out. And he goes, "What's that smell?" I'm like, "That's you, man."
That's you.
And he just laughed. He's like, "That's gross."
Okay, so you want to pull an arm's length worth of floss because you want to use a new section as you move along. You don't want to transfer bacteria if you just keep using the same piece. So what you want to do is you C shape against the tooth and then come back up. And you actually want to go below the gum line, you know, just be sure not to be too rough with it and come back up. What I don't like with the floss picks is you don't have that accessibility to do it as well and you're using the same piece as you go along. So I definitely recommend string floss. Anything to add?
Nope.
Thank you guys for joining in our video. Be sure to check out their channel. We'll see you next time.
Bye.
have white teeth like Kanye West. Oh, wait, who? Kanye West.
Kanye West.
I don't know why I was thinking Kanye West. They're all coordination.